Hi, my name is Dr. Davis Han. I'm here with my colleague, Ling. Okay, I'm a family doctor, and Ling works as an MOA with me in the office. We're here in Edmonton, Alberta. As the COVID-19 pandemic will be rolling around, it's probable that many of us will at some point be needing testing, and I'd like to demonstrate the procedure. Currently in Alberta and the rest of the world, we are utilizing an empty swab. This is the same way we test for influenza and other respiratory viruses. This takes about 1 to 2 days to process currently in Alberta. At least that's how fast I'm getting my results. Although the lab actually only needs a couple hours to actually do the testing, but just in terms of getting the report, we're looking at 1 to 2 days. So this swab collects a sample from the nasal pharynx, which is behind the nose but above the throat. Okay. The technique was demonstrated on CBC National, but it wasn't quite done the way I usually would do it myself, so I just wanted to show it in a different way so that if you have to get tested, you would know what to expect and how you can cooperate with the health professional to make the process a bit easier and faster. First of all, the health professional will be fully protected. The empty swab is not considered to be an aerosol generating procedure, so we only need a surgical mask and not N95. The patient should be seated comfortably with the head tilted back slightly. Okay. And if there is any nasal congestion, if the patient has a runny nose, I'm going to give them a tissue first to blow their nose if they need to. And if we see that there is additional discharge, sometimes we do use a cotton swab to clean any additional discharge from the nose. Okay. But her nose is clean, so we don't need to do that. Okay. So we always do have one nostril that is breathing a little bit more open than the other. That will typically be the nostril to do the procedure. It will be a bit more comfortable for the patient. So Lynn, can you tell me which side, which nose do you think is a little bit better to breathe with? You can check and just push on. You can push on your nostril and see which side is more open. Left. Okay, so we'll be demonstrating procedure going into the left nostril. Okay, so the entryway into the nasal pharynx isn't actually straight, so the swab will actually go kind of like this, and to facilitate that so that it doesn't feel like it's poking too much, because it can be a little bit uncomfortable, I prefer to just bend it a little bit so that it will follow the curve inside the nasal pharynx, so it's not too uncomfortable. The patient, I usually ask them to lower the mask only once I'm ready to do the procedure, and I would ask you to lower the mask just below your nose, but covering your mouth. Okay, so please do that. Okay. And this is because sometimes when you do it, the person might sneeze or cough. Not everyone does. And you would want to avoid any droplets and particles going out into the environment. So now we're about to be ready, so I would also get you to get your tissue ready. Okay, so sometimes if you have to blow your nose after, or if you do sneeze, you can have that tissue to cover, and then you can bin it afterwards, so that you, again, try to minimize any contamination of the environment. So here, I've got my swab ready. I've got it a little bit bent, and I'm going to insert it into the left nostril, and we're going to insert it the full distance here so that we reach the nasal pharynx. Okay, so I usually support the head so the patient doesn't move backwards. So just bear with me. And I'm going to twist it a couple of times to make sure I collect enough sample. And that's it. And we're going to put this sample into a container, especially made for transporting viruses. Okay, so just to continue, there we demonstrated how to collect the sample. Now, normally I actually try to avoid doing this in the exam room because I want to have minimal exposure within my clinic. So what I've been doing is actually collecting the samples in the car, and I would ask the patient to sit on the passenger side because I'm right-handed, and then they would just roll down the window, and I would collect the sample beside their car so that there would be minimal exposure to myself and to my clinic environment. And doing it in the car, it can actually sometimes be easier because some people can just support their head against the headrest or they're not going to be moving back. So anyhow, thanks for watching this video. This is what I like to do after hours and abuse my staff and make them do videos they don't want to do. So, okay, thank you, Lane. All right, thank you very much.